Hey guys, welcome back to my channel. Thank you for the love that you've shown me in my previous videos. Yeah, today I have a special guest too. Yeah, she's my sister. She's Yvonne Opanga. She's a nutritionist. Yeah, so she'll introduce herself and then we move forward. Welcome.
Thank you so much, Linda, for the beautiful introduction. And indeed, as you mentioned, I'm a qualified nutritionist. But I also practice in other areas of health, especially doing a lot of health research. But my main areas of expertise then it's in infant and maternal and child health, in addition to non-communicable diseases. But basically today we are going to talk about breastfeeding.
Yes. Yeah. So it's the World Breastfeeding Week. It runs from 1st of August to 7th of August, yeah. So today we are just going to talk about breastfeeding. So if you have a child, if you have a sister who has a child, if you have any relative of yours who has a child, please come here. Today you're going to have tips, yes, from the very best. Yeah, so without much further ado, let's start. Let's not blow our trumpet. Okay, let's start. Yeah, so basically what is breastfeeding? If someone says breastfeeding, what do they mean?
Okay, if you look at the term breastfeeding, then it has basically two components, the breast and feeding. So it means feeding from the breast. So this is a process where a mother after delivery has to feed a child, and basically with milk from the mother. And sometimes a mother would feed either directly from the boob, but others then, since at that particular time there's quite a lot of milk production, especially immediately after delivery, then some mothers do express their milk. So some of them again do a lot of bottle feeding, but again it's something that we'll discuss and see, are there any advantages of bottle feeding, are there any disadvantages? So basically breastfeeding is just feeding the baby with milk from the mother.
Okay, yeah, just such a short and precise definition. So we can look at now, what are the advantages? Why would we advocate for breastfeeding? Yeah, so you can tell us more about breastfeeding advantages. Yeah, so anytime we talk about breastfeeding, then of course in someone's mind or in a lady's mind, then it clicks a nutritionist. Yeah. Because basically that's what we do, and encourage exclusive breastfeeding, especially for the first 6 months. So what is exclusive breastfeeding? Basically that means a mother breastfeeding a child without necessarily giving any other fluid, not even water, to this particular child, just feeding the child with breast milk for the first 6 months. So the first 6 months you're supposed to give a baby just breast milk, nothing else?
Yes. So people should just do away with that myth that when we advocate for breastfeeding, then the breast milk is actually enough for the child. Okay. Yes, so you don't need to add water, you don't need to add tea, you don't need to add all porridge. Porridge, all those fluids that people give babies. Yeah. It's not recommended. Yes, so what is recommended is breast milk. Okay. And why is it important for us to actually feed babies on breast milk? One, breastfeeding, or rather breast milk is safe for the child, in that there's not any contamination that can occur. It's just milk coming from the mother's breast. And of course at that particular time we talk to the mothers about good hygiene measures, so that again the child does not get infected at that particular time. Then apart from that, then breast milk actually contains, the first few periods, it contains what you call colostrum. So it comes out as yellow, milk in yellow color. And that one has quite a lot of antibodies that then helps to boost the immunity of the child. Yeah,
so in simple terms, antibodies, these are just substances that are produced in the body in order to help fight an infection.
Yeah. Very, very well put. Yeah. So again, the other advantage is, usually when you breastfeed the child well, there's that first stool that needs to come out, that's called meconium. Then of course breast milk facilitates that process of meconium. Then we talk about, again, in terms of intelligence. Studies have shown that children who are really breastfed for a period of 6 months and even up to 2 years, we'll talk about beyond 6 months, up to 2 years, then they've shown at least high IQ levels compared to those children who are not breastfed. Okay. Yes. So in addition, there's also the bonding between the mother and the child. At that particular time, you've just given birth to your child, and it's important for you to bond with the child. So breastfeeding actually helps that. And also in terms of just maintaining the temperature of the child, you know, the body attachment and the aspect of the kangaroo one, then it just helps to maintain also the body temperatures for the child. Then if you look at also the temperature for breast milk, then it's very adequate for the child. And like maybe if you're boiling porridge, you might boil at
them hot.
high temperature, and then it burns the child. But in terms of temperature, then it's very good and adequate
for the baby.
For the baby. Then of course, in terms of nutrients, which is the main key thing, breast milk contains all the nutrients that the mother that the child requires. For instance, if you look at the way the breast is structured, or how milk is structured while in the breast, then usually the first part of the breast usually has water. So you find that when milk is coming out, it looks watery. So that is what gives the baby a lot of water, so that at this particular point you're not supposed to give water
to the baby.
Yes. Then that is usually called the foremilk. Then you have what you call the hind milk. So after you breastfeed for about maybe 10-15 minutes, if you just press a little bit on your boob, you'll see that the milk now changes in terms of thickness. So it stops being light, then it becomes very thick. And this is the one, whitish in color. And this is the one that contains most of the nutrients that the baby requires, in terms of the fats, in terms of the vitamins, in terms of the protein amount, yes. So you find that the nutrient composition of milk is actually very adequate, for the baby. So you can think about that as benefits of breastfeeding for the baby. Then also in terms of developing teeth and the facial bone, then it's also been proven that when the baby suckles, then of course, that helps in terms of that form of development. There are also advantages for the mother. So the mother is not left behind.
Not left behind.
First of all, it's been shown that breastfeeding, if you practice exclusive breastfeeding, then there's a very low risk of you developing breast and ovarian cancer. So it's actually a protective factor. Yes. Then the other factor is also a way of family planning. It's been proven that if you breastfeed exclusively for a period of 6 months, then it's a way of family planning.
Production.
Yes. Then you also have the production of oxytocin, which just helps to shrink the stomach back. Yes.
So that's why you're always told when you breastfeed, your stomach goes back in and you tend to lose weight.
You tend to lose weight.
So it's actually true.
It's actually very true. Because when the baby starts suckling, I remember from my experience, the first time you really feel a lot of contraction within, a lot of cramps, a lot of contraction, and those contraction is actually the uterus trying to go back to its normal position. So again, it facilitates that process. Then a very positive thing for us women, because we love our bodies, it's actually a way for you to lose weight as well. Yes,
baby fat.
Exactly, baby fat. So as the baby continues to suckle, as they gain from you, then it also helps in terms of weight management. So that's why we encourage mothers that it's very important for you to practice exclusive breastfeeding. So it's not only exclusive up to 6 months. If you look at the World Health Organization guidelines, then it's recommended that we breastfeed children up to 2 years.
2 years?
Yes.
That's a big baby. How do you breastfeed a 2-year-old child?
No, it's very important for them, especially as they build up the immune system. The breast milk is very important. But you find that most mothers and who are working, then sometimes it becomes a challenge. But maybe it's a topic that we can talk about
later.
So you find people, once the child has finished 6 months, then
they stop breastfeeding.
Once they introduce complementary feeding and the child feeds well, then they do stop. But a very important point that you need to note is that for breastfeeding, then the breast milk is actually adequate for the baby. And if the baby feeds very well, then in terms of sleeping, they will not disturb you. The baby just feeds and then goes to sleep, because again at that particular time a mother really needs a lot of sleep.
Yes.
So if she does it adequately, then usually it's very important.
It's important.
Yeah.
Okay, yeah. So we've talked about now the benefits. You can actually see why we actually recommend someone to breastfeed exclusively for 6 months and then up to 2 years. Yeah. So working mothers will have a solution for you. We'll provide, like, we'll do another video, and then so that you can actually continue breastfeeding your baby or feeding your baby with your breast milk up to 2 years. You don't stop them once they reach 6 months, because it has benefits to their health, as we've seen. Yeah. So there's been this complaint that some new mothers don't have breast milk. Some of them say, I've just breastfed my baby and then I've just seen blood coming out. So what foods should someone take, or what should someone do in order to increase their breast milk production?
Yeah, very important question. And especially a lot of young mothers do suffer a lot. Yeah, since they're just getting into motherhood and they're learning. Yeah. So one, I'll start by what happens at the facility. So after a mother gives birth, then it's very important that you put your baby to the breast within 1 hour after you deliver. Whether you've done a cesarean section or whether you delivered normally. It's important within 1 hour. Then it's important for mothers to put the baby at the breast, so that at that particular time, then now that process is initiated. And the minute the baby starts suckling, then often milk comes out. But if you delay that process, then there are chances that
you'll have issues.
You'll have quite a lot of issues. So the initiation period, which is within 1 hour, is very important. It sets the psychological beat again of the mother. So quite a lot of new mothers complain that, one, they do not have milk, but breastfeeding is actually psychological. Yes. So once you start breastfeeding, then definitely milk will come out. But there are factors that actually facilitate the process. And there are also things that seem like barriers to it, which you can talk about. And the question that you ask is very valid in terms of nutritional components. So maybe just to jump on nutritional components before we talk about other factors. So in terms of nutritional components, then usually the type of food you eat, then again helps to facilitate milk production. You know, basically in terms of calcium intake, it's very important because that's the main component in milk. It's very important that during lactation, then a mother has to get a lot of foods rich in calcium just to enhance the milk production. Again, you're talking about fluids and very nutritious fluids. So you're talking about alcohol is another thing that again we'll talk about it in terms of barriers to breastfeeding. So in terms of fluids, then it's important that you take in nutritious fluids. So a mother can have some tea. Usually chocolate actually helps in terms of increasing the amount of milk. Water. Water is very important, and actually the healthiest of all. Fresh juices. So I'm not talking about Del Monte juice. I'm not talking about
we are not throwing shade at brands. This is purely just learning, because these are the common brands that are available in the market.
So what we do recommend, because nutrition, you're talking about healthy eating, so we recommend that you buy your fruits, go and blend them, so that now you get the juice out of it. So consuming adequate amount of fluids, then it's usually very important. Then some people do recommend porridge. Also porridge can be good. If you're good with taking porridge, then it's also important that a mother can consume.
White or black porridge, or any porridge can do?
I think any that can do, but what we discourage is taking porridge that has a lot of things. Napata porridge ikona njugu, omena, it has all those things.
Every concoction that you can imagine.
Usually we discourage that because of, in terms of mixing. For example, if you put in soya, and soya that has not cooked very well, there's a high likelihood that it may predispose you to some kidney issues. So it's very important that for porridge, usually we recommend only 2 cereals. So if you're doing maize, you can do maize and wheat, or you can do maize and sorghum, millet and sorghum, So whatever it is that you mix, at least mix 2 cereals. That's the recommended in terms of nutrition standards. Yeah, because again, if you mix, we have some of the cereals that contain anti-nutrient components that maybe inhibit things like iron absorption and also bind calcium. Yeah, for example, the phytates, and all those, they might bind calcium, so you might not really be getting exactly what you want. Yeah, so you also need foods rich in vitamin C, foods rich in iron, and there's also always this correlation between iron and vitamin C
and iron absorption.
Yes, so vitamin C enhances iron absorption. And remember, this particular time, a mother also needs quite a lot of iron in her body. So again, consuming a lot of fruits and vegetables is very important for us. Yes.
Yeah.
Including also the B vitamin, the complex, especially vitamin B12, is also very important because it enhances the ability of absorption for folic acid.
Folic acid.
Yes.
Oh yeah, the B12 and folic acid pathway. Who had forgotten that?
Yes.
Anyway, yeah.
Yeah.
So,
and then just generally, it's important for a mother to consume, and we call it a healthy diet or an adequate diet. An adequate diet is a diet that contains most of the nutrients that you require. So in terms of nutrition, we stop talking about balanced diet because sometimes it's not very easy for you to balance the amount of carbohydrates, the amount of proteins, and the amount of because if you talk about balance, it means equal. But in terms of calories, in terms of nutrients, then the requirements differ. So you talk about an adequate diet, and you also have what we call food groups. So you have about 13 food groups. So we have cereals, we have legumes, then you have fruits and vegetables. Then under fruits and vegetables, we have vitamin A rich vegetables, vitamin A rich tubers. Then we have what we call water is also among the food groups. Then we have the meats. Again, organ meats are very important. Things like the liver, the heart, those ones are also key. Then you also have these flesh meat.
Flesh meat.
Which you need to also consume. But again, when you come to flesh meat, in terms of the nutritive component, then it means you should avoid meat that has a lot of fat.
Or like pork.
Pork is okay once in a while. But now, for example, the red meat, when you buy, and it has white patches. Those white patches are usually fat. So when you're preparing your meals, then it's very important that
you scrape them off.
Yes, you scrape them off. Then of course, just making your diet including a variety of foods within your diet. So we usually recommend about 4 food groups at least within your diet. And remember, also in terms of nutrients, you need to have your proteins, your vitamins, your fats, and then
carbohydrates.
Your carbohydrates. So generally a healthy diet will do.
Then you talked about some factors. You were talking about some factors which actually suppress milk production. So we can talk about that.
All right. So before we go to that, there's also the aspect of factors or components in terms of nutrition before I leave the nutrition bit, or rather foods that can inhibit production of
milk.
So most people talk about coffee and the caffeine component. And usually some people even use caffeine as a way of preventing, like stopping the milk production after maybe the child has reached 2 years. Though I don't know that correlation, it's something that maybe you need to research more about. Again, if you are lactating, then it's important that you avoid alcohol. Because of course alcohol affects your mental ability or your ability to think well.
And it's also excreted in breast milk, so it will end up affecting your baby.
Affecting the baby, yes. So it's also important for you to avoid alcohol. Sometimes gas-forming foods, like maybe beans, they're very nutritious. But again, the way you prepare beans, sometimes if you eat beans, you might find that because whatever a mother eats is what now the baby will eat. So sometimes gas-forming foods like beans, if you eat them and you've not prepared them well, then you find the baby can also experience colic. But colic also comes as a result of how you position the baby.
How you latch.
How you latch the baby during breastfeeding. So I'm not saying that we avoid beans, but what I'm saying is the way you prepare. So if you want to avoid the gas component in beans, what you do, you have to soak your beans for a period of time and then pour out that water. Then rinse the beans and then boil them. Yeah, so that now by doing that, then the components that produce gas, I'm not sure about them.
It's okay, we'll just call them gas producing components.
Yes. So it's very important to maybe just highlight on that. Yeah, then when you come to other factors, it all boils down to the psychological bit of the mother. Very young mothers who complain that there is no milk, then usually it's psychological. That's why it's often important that nutrition counseling is done after a mother delivers, so that a mother gets accustomed to that particular process. Then we also have generally the attitude that you go in with in terms of breastfeeding. So if you have a poor attitude and in your mind you're thinking that I will not have enough milk, I will not have adequate milk, then of course that will affect you. So you just need to go in with a positive attitude. Again, the other factor is prevailing myths and misconception. Yeah, people believe, especially whenever you do nutrition counseling, you find that if you're staying with your grandmother, you know, there's some things that they used to believe that they'll keep telling you. So myths like, for example, a baby needs to be given water, a baby needs to eat food. You know, a baby, maybe breast milk is not enough for the baby. So all those myths sometimes can influence the way a mother thinks. So it's important for you to avoid whatever, such myths. That's why during pregnancy, when women who do antenatal care visits, then usually nutritionists talk to them and also just prepare them psychologically and give them the correct information. Then of course support. It's very important that a breastfeeding mother gets support at
the family level. So husbands supporting their wives and also just general support. If you're living in a large family with extended family members, then if they give you the support, then definitely everything will be fine. But if a mother strains, then often it becomes a challenge. So that time a mother really needs a lot of peace. Okay, so just a bit of the pharmacology behind the stress and milk production. So stress, when someone has stress, there's usually a stress hormone, in quotes, that is produced, which is called cortisol. So cortisol is the stress hormone, and what it does, it just suppresses the production of milk, suppresses prolactin production. So at the end of the day, you won't have milk when the cortisol levels are high. So that is the correlation between cortisol and milk production and suppression of milk production. So I hope that makes a little bit of sense.
So maybe other factors that you can also look at is that maybe there may be challenges to breastfeeding, but again, these mothers undergo a lot of counseling and guidance. Is a mother probably who's given birth to triplets, or maybe twins. Again, sometimes it's a bit challenging, but if the mother then practices the correct in terms of feeding, then they'll have adequate milk. If they're taught how to position the two babies together as they breastfeed, then they'll be able to pull through. So it all talks about, or it all boils down to preparation prior to delivery. And again, the other factor that people complain about is working. So working mothers again also face challenges in terms of reaching 6 months, because if you look at the way the system is, usually mothers are given either 3 months, other institutions give 1 month. So if you're not prepared very well, then sometimes the minute you go and start working, stress work, stress related to stress related to work can influence that. So it's also very important that institutions where we work actually have baby-friendly environments where mothers can breastfeed. And an example is Safaricom. They have a very good center that if we as organization will borrow from that, then
at least every child will be comfortable, because you can imagine a 1-month-old baby is not being breastfed because of stress related to work. It's really not. It's doing a lot of disservice to the baby. Yeah, so for the employers out there, please try and consider that.
Yeah.
Yes,
and also
it will be
aspects,
very good. Yeah.
And also aspects about flexibility, flexi working hours for lactating mothers. That's very important. And also the aspect of having a lactation room. Yeah. At the workplace, whereby maybe a mother can go and express milk. Because again, if you're working, if you just delivered within 3 months and you're working, and at that particular time milk production is usually very high. So you can't even stand 3 hours with that. You really feel sick. So at least having a lactation room within the workplace, then it's very, very important.
And then that has just reminded me, like, don't always look at people who are breastfeeding in public badly. Yeah, because I've seen some circumstances in public means of transport and some other just public areas when someone just chucks the baby to breastfeed the baby. People look at like the parent badly. No, you shouldn't look at that person badly. It's a right. The child has a right to feed. Yes. So stop stigmatizing breastfeeding mothers. It's very important.
But again, for mothers out there, let's do it in a dignified way. Yes.
Yeah. And then also I forgot to mention, it's COVID period and there's some issues about COVID and breastfeeding. People are not so sure about that. So despite your condition, even if you have COVID, you're encouraged to breastfeed your baby because of the benefits. If you have HIV or any other disease, apart from, let me say, cancer, which you can be given chemotherapy, which is harmful to the baby, that is when you're told not to breastfeed. But any other disease, I think you're allowed to breastfeed. So breastfeeding is really, really important. Don't let your child not breastfeed because you have a condition. So maybe I'll just add other conditions that you may be exempted from breastfeeding in the description box so you can read through. You brought out a very important point that I think it's important for us to highlight. HIV and breastfeeding. Nowadays, mothers who are HIV positive actually do breastfeed exclusively up to 6 months. Whatever we do recommend as nutritionists, if you are HIV positive and you choose breastfeeding, please do it up to 6 months. Do not do mixed feeding where you're giving breast milk and maybe you're giving other foods, because there's a high risk of you maybe transmitting the virus to the child. So we usually advise mothers, if you choose breastfeeding, do exclusive breastfeeding up to 6 months. If you choose any other form of feeding, then of course that is allowed because it's by choice. But usually we advise, and evidence has shown that children who give birth, who HIV positive mothers give birth, and the virus is contained through the PMTCT program. Prevention of mother to child transmission.
Those mothers can actually breastfeed a child and the child will not get infected.
So what usually happens, they just give the baby ARVs. There's a certain type of ARV that they give to the infant when they're being breastfed, and then it will prevent them from actually contracting the virus from the mother. It's possible. I've seen so many children being given that in my practice and they're okay. So if you're HIV positive, please continue breastfeeding your child. Do not leave your child. Do not let your child have a weak immune system.